So hello guys, what's up and welcome back to my channel. I'm Fam Vivian, and in today's video we will be discussing some misconceptions about stroke. A stroke is a life-threatening condition when the brain does not get enough blood flow. This could happen either with the blockage of a blood vessel that supplies a particular area of the brain, or a rupture of a blood vessel that leads to bleeding in the particular area of a brain. Without a steady supply of blood, the brain cells in that area would start to die off, and the part of the body controlled by that area of the brain will start to lose its functions. In the United States, about 795,000 people suffer from stroke every year. Stroke is also the leading cause of long-term disability. 2/3 of the stroke survivors are currently disabled, and around 25% of people who recovered from their first stroke will have it again in 5 years, with 60% in women and 40% in men. So that was a brief introduction to stroke. Let's dive into popular misconceptions about stroke. Number 1, stroke is a spiritual attack. This is a very popular belief in Africa. Some people believe that stroke is a spiritual attack sent by their enemies or sent from their wicked family relatives. Most of these people spend time, weeks and months, looking for a miracle pastor or a native doctor instead of rushing to the hospital, because with stroke, time is of the essence. The longer stroke is left untreated, the worse its effects. Like I said, stroke is a problem of the brain. It happens either by the blockage or the rupture of an artery or vein in the brain. Stroke is preventable, and you can reduce the risk factors by checking your blood pressure, watching your weight, eating healthy, reduce alcohol, watching the sugar level, and you quit smoking. You are at a better edge than someone who does none of this and yet will blame the enemies when he has a stroke attack. The second misconception is stroke does not run in the family. The same way we inherit blue eyes, brown eyes, curly hairs, is the same way many people also have a high risk of stroke from family history. Family history of stroke means you have a first-degree family relative who has experienced stroke, either hemorrhagic stroke or ischemic stroke. If you've had a family member who has had a stroke, you should please refer to number 1 to follow those health guidelines I gave out, and also go for routine checkups with your doctor if you feel signs of stroke. Stroke symptoms are hard to recognize. The most common symptoms of stroke can be acronymed into be fast. I'm going to list them out shortly, so when you see the symptoms in someone else or in yourself, it's an emergency to rush to the hospital. B is for balance. Is the person suddenly having difficulty balancing or maintaining posture? The E is for eyes. Is the person suddenly experiencing a blurred vision or a loss of vision in one or both eyes without any form of pain? F is for face dropping. Does one side of the face drop? Has one side of the face become numb? You can ask the person to smile. Is the smile even? A is for arm weakness. Is one arm weak or numb? Ask the person to raise their hands. Is one hand dropping without control? S is for speech difficulty. Does the person now have difficulty speaking, slurry speech? And T is for time. Stroke is an emergency, so when you notice any of the symptoms, you rush to the hospital, because the earlier you get to the hospital, the faster the recovery process will take. The fourth misconception is that stroke cannot be treated. There is an incorrect belief that strokes are irreversible and cannot be treated. emergency treatment of a stroke with injection of a clot-busting drug, or a minimal invasive mechanical thrombectomy for clot removal or surgery can reverse symptoms in many patients. Research also shows that those who arrive at the hospital within 3 hours of experiencing these symptoms typically have less than 3 months of disabilities, better than those who wasted time before heading to the hospital. The fifth misconception is stroke occurs only in the elderly. Unfortunately, stroke can affect anyone irrespective of their ages, and the rates of stroke patients under 50 are on the rise by approximately 15%. Binge drinking alcohol, the use of cocaine and other hard drugs, and sickle cell diseases are among causes of stroke in the young population. Before we move to the next point, please subscribe if you're yet to do so. Turn on your bell notifications so you'll be notified when we post a video. Also, like and share this video if you find it educating. Thank you. The next misconception, which is stroke causes paralysis. Stroke is a leading cause of long-term disability, but not everyone who has stroke will experience paralysis. The long-term impact of stroke varies on so many factors, such as the amount of brain cells involved and the area it is affected. If the stroke occurs on the left side of the brain, there will be paralysis in the right side of the body. Memory loss, there will be speech problems, and there will be slow body movements. If the stroke occurs in the right side of the brain, there will be a left side paralysis of the body, memory loss, vision problem, and uncoordinated body movements. The seventh misconception is that strokes are contagious. Strokes are not contagious and cannot be passed from one person to another by mere physical touch. Social withdrawal is the most common cause of depression in stroke patients. So please, if you have a friend or a family who has had a stroke, don't withdraw from them. Encourage them and help them within your own abilities. The next misconception is stroke recovery happens fast. Recovery from stroke can take months, if not years. Research shows that the critical window between 2 to 3 months after stroke onset, during which intensive motor rehabilitation leads to recovery. Improvement is possible, but sometimes it could be slow, and for some other person may require to live in nursing care home facilities. So that brings us to the end of this video. Please subscribe if you're yet to do so, and turn on your post notifications so you'll be notified when we post a video. I would really love to read your comments in the comment section about the popular misconception you heard or you believed about stroke. Please like and share this video. I'm Fam Vivian. Till I see you in my next one. Bye for now.